We're also presenting a additional cohort in the ZUMA-1 study where we're looking at different ways of managing toxicity. So there was an additional cohort where we've treated 31 patients so far. And for these patients, 2 days after they're infused with the Axicabtagene ciloleucel, we give them prophylactic Tocilizumab. Tocilizumab has been approved by the FDA as a drug to manage cytokine release syndrome. So when patients achieves or exhibits a certain level of toxicity, we know that this drug can be effective at reducing the side effects. In this cohort, we're testing what happens if everybody at day 2 after infusion received the Tocilizumab, regardless of if they have any symptoms of cytokine release syndrome at that time, whether we can reduce the severity or the incidence of the cytokine release syndrome and neurotoxicity, the 2 most common side effects that's unique to CAR T treatment. And what we have seen so far in the 31 patients treated is that indeed we're seeing a lower incidence of more severe cytokine release syndrome. So as opposed to the 101 patient that was treated in the pivotal phase 2 cohort, where we saw about 13% of grade 3 or higher cytokine release syndrome. So that's the level where patients would need to go to the ICU for higher level monitoring and management. In this cohort, when they're prophylactically treated, we had about 3% only of the patients that had this high level of cytokine release syndrome. However, the neurotoxicity, severity, and incidence did not seem to change at about 33%, which is pretty comparable to what we saw in the pivotal cohort. Again, that appears to be consistent with what other people are learning as well about CAR T treatment and management of toxicity, in that the biology of what caused these side effects could very well be very different, and therefore the treatment with Tocilizumab that's targeting the cytokine may not do anything for the neurotoxicity.